Adam, so great to have you on the podcast. How are you today?
Great to be here. Thanks for inviting me.
Yeah, I'm excited. Let's kick things off. It's your first time on, so would love if you could start out with a little bit about your background and then give us an overview of Maribel Health.
Sure. So I'm a hospitalist by training, still practice part-time at Dartmouth Hitchcock Medical Center. I've been doing that since, 2006, so a long time now. And then most of my career, I've been building healthcare services and healthcare technology companies. So serial entrepreneur, which has different connotations to different people, but I just love building companies and solving healthcare problems. And so Maribel is my sixth company that I've done, and really focused on technology and the intersection of using the home as a way to solve problems for health systems and payers and patients. Right. So it's sort of my loves. My loves are working in the hospital, building teams that deliver care in the home and community, and then integrating in technology. And so I've been pretty lucky building a career here in Hanover, New Hampshire to do that.
Absolutely. Beautiful area.
Yeah,
Not a bad spot to work every day.
the best. We were skiing up until last weekend, cross country skiing. So Hanover's a gem. I shouldn't talk about it too much because we don't want too much influx here, but it's a wonderful place to live, raise kids. We've got 4 kids. My wife's a pediatrician, and the hospital's amazing. So
I love it. Yeah, it's went up there growing up in New Hampshire only like once or twice, but the times I went up there, I was like, the amount of tennis courts here is insane.
tennis
But
courts, cycling, great gravel roads, cross country skiing, downhill
yeah,
skiing.
everyone's outside. The first
Yeah,
thing I notice is everyone is outside all the time.
very active community. People love rowing, believe it or not, right? So the Connecticut is a very well-known place for rowers to come. We've got, I think, the highest per capita number of Olympians, former Olympians that live here, both winter, mostly winter, obviously. But
Mm.
yeah, it's a great place to raise kids, and as a healthcare person, it's been great because I I trained after medical school at Dartmouth Hitchcock, and they have something called the Dartmouth Institute up here, which is basically it was one of the first health research organizations in the world. Really started by Jack Wenberg, in the 1980s, and they did a lot of work on healthcare, inequality, preference sensitive care, sort of these things that you wouldn't expect necessarily from the outside to think about how healthcare delivery happens. And so it sort of shaped how I think about healthcare and how we build new and better systems to provide higher quality, lower cost, and more convenient care to more people. Right. So it's been a great community to both live in, raise a family, and then build healthcare organizations. So
Now, Adam, can you, if you can't, just say you can't, but like, can you tell us more about like the health systems that you work with and how you're supporting them today or any of them?
sure. So I mean, and by way of background, so I've worked with lots of like different healthcare systems over the years. Obviously as a hospital, started with Hitchcock, but I kind of got started with an organization called Bayada, where I built a hospice program. Started in Vermont, grew it to 6 states, 16 sites, and I learned along the way that if you're building services in the community, you got to be able to work with many different types of organizations. So whether it's physician groups, skilled nursing facilities, health systems, payers, right? And I cut my teeth doing that. Did that for about a decade. And then started a number of different companies, usually in partnership with other health systems or payers. So I co-founded of a company called Go Health Urgent Care, which is the second largest urgent care operator in the United States and does joint ventures with health systems. So 11 different not-for-profit health systems, builds out the urgent care footprint. Started a company called Maribel Health, which does PACE programs, so program of all-inclusive care for the elderly. We did a joint venture with Sutter as a way to launch that company, and it's doing a lot of work in PACE. A company that does substance use disorder care called Better Life Partners, which partners with MCOs, so managed care organizations and state Medicaid, and then community organizations like churches and you know, recovery centers and physician FQHCs, things like that. And along the way, that I've learned that like partnering with organizations is a great way to help them advance their strategic priorities, while also building new models for patients and payers. So a couple of years ago, I was thinking about the next business that I wanted to do, which is bridging the home and the hospital, right? And I had my wife's best friend at the time was a woman named Maribel Sanchez Souther. And at 39, she developed metastatic breast cancer while she was pregnant with her third child. Here in Hanover, living in Hanover, my wife and I are both doctors, and she, had she got great care from the hospital, but a lot of the care that she wanted could not be done at home. It was just inconvenient to get it. The systems didn't exist, and so it was a frustrating kind of care delivery experience in many aspects, because she was trying to raise her family, her three young kids, and be at home as much as possible, and a lot of times couldn't get that care. And so she ended up dying of breast cancer. And I was like, something didn't feel right. I'm like, my wife and I are both doctors at the hospital. I know a ton about home and community based services. Why can't we connect the dots? And so I wanted to build this company, which we call Maribel Health. And I partnered up with my co-founder Ron Paulus, who was the chief innovation officer at Geisinger and came up with the proven care model, and then the CEO at Mission Health in Asheville, North Carolina, for a decade, and then was working at General Catalyst, where he was an executive in residence. And he was thinking about the same set of problems. And so we partnered up with General Catalyst backing us to start Maribel. And the company's really focused on partnering with health systems and eventually payers to use the home as a way to, improve quality, improve convenience, and reduce total cost of care, while solving other sorts of problems, right? So capacity is a big issue, right? So health systems have capacity issues on the ED and the inpatient side. There's workforce issues that we're thinking about, and how do we use technology to solve some of those workforce issues. And then there's total cost of care, and trying to make sure that we can use the home environment to bring it down. So that's why we started the company. Our current people that we're working with, we've got multiple different organizations we're working with. The two that are public is Mercy in St. Louis, and then Bayada, who are two that we're working with, which is a large national home healthcare provider.
Todd Latz from Go Health was on
Sure.
way back in the day. Like this particular show is approaching 500 episodes. He was like 120 or something like that. Like early. And then I always mess up his last name. Is it Jeffrey Kang from Welby?
Cy France, the CEO. There's two different Welbys.
Oh,
There's
different
there's
one.
Welby Health, WELBE, which is PACE, and then there's WELBY. So I'm a co-founder of WELBE. But you should have Cy on, well, or Matt Patterson.
Yeah, that would be
That's
cool.
an incredible company.
We'll do that. We'll have them on as well. Really cool what you've built so far, and obviously, you and I were talking a little bit before. One of your early team members I've known now for a few years, so I got to hear the excitement from her. Well, shout out to Sharon, if she's listening.
I'm sure she will. I'm sure she will.
Yeah, I got to hear the excitement, in her voice when she like early on when she was starting to work with you on this, and it's great to see how it's continued.
Yeah, Sharon, and I worked on hospice together for, I think, 8 years. And it's an amazing model. Love working in hospice. And she was an early kind of operator with me, getting it done. And one of the things that we learned about home and community based care is that it is so team driven, and it's really about the people, right? It's about having a great culture, it's giving the right tools to the people, but it is extremely difficult to operate. And it's because, you can't walk to a physical location like a hospital ward or floor or an ambulatory clinic where everybody's in one place, it's a distributed model, right? So you have, you often have a central hub or an office where people, there's some people doing kind of administrative work, but the field staff are distributed all over the place. And so it was like a really great way to learn about interdisciplinary team model, a per patient per day payment model in hospice, but then how to manage and a distributed workforce. And that was a lot of the inspiration for what we wanted to do in Maribel, and why Sharon was like such a natural fit, because she had this experience in, both with telehealth and virtual care through SteadyMD. And then, we'd worked together for, better part of a decade operating in this kind of distributed workforce environment. And so bringing her into the company to help us work on it was natural.
I want to shift focus a little bit to what's happening in the industry right now. Adam, there's been a lot happening recently. We had the Dispatch Health acquisition of Medically Home, and also the recent acute hospital care at home waiver extension. What are your thoughts on this recent industry movement across the board?
Yeah, so I think that we'll start with the extension, right? So there's been a waiver called the acute hospital care at home waiver that came out in the sort of immediate post COVID era, which allowed for an inpatient DRG to pay for hospital level care at home. So, and that really kind of unlocked a market. So, whenever there's a payment model, obviously it gives people the incentive to invest in it and try to figure it out. And so there have been something like, order of magnitude, I think around 150 different hospitals and health systems around the United States that have applied for the waiver. And this allowed them to build these models. And so Medically Home in particular was, one of the pioneers in hospital at home, particularly inpatient level care at home. And so they really helped to fuel a lot of the growth and teaching people how to do this model. Dispatch, similarly, super pioneer on, a lot of it was more urgent care at home kind of services. So avoidance, ED avoidance. There were many, many markets with Medicare Advantage and kind of contracts. And so, what we saw those pioneers really help to build this concept of acute care at home and build up the market, and they saw a lot of growth. And so what recently has happened is that, as part of the continuing resolution in Congress, the waiver that enabled for this acute care at home to happen was extended, but only extended for 6 months. And so there was initially a 5-year extension on the table, but at the end of 2024, it got punted, just like everything else in the continuing resolution, to be short-term extension until the end of until the end of March, and then that got another 6-month extension until September. And so what that means is it's just taken some of the wind out of the sails of acute hospital care at home. And because, there's some uncertainty as to whether Congress is going to, make this a longer term extension, multi-year, or if it's going to become permanent legislation, or what the pathway to doing that. And so I think there's been some pressure, right, to kind of consolidate. And, the Dispatch and Medically Home coming together is a reflection of some of the uncertainty in the space, and bringing these, two organizations together, I think is net very good for the industry, and hopefully helps us to, get some additional advocacy firepower to ensure that the extension continues, through legislative action.
I'll agree with you. I think when you have announcements like that, it's very good for the industry. It continues to push everyone forward. So it'll be interesting to see how that continues to play out. I want to shift focus, kind of two last things before we wrap up here. How would you describe your leadership style?
I love finding great people who, and inspiring them and giving them the tools to do great work. We mentioned Sharon, so she's somebody I've worked with for a really long time. And so, from a leadership perspective, I really just sort of, my number one thing is a cheerleader of the team, and trying to give direction so that people can do great work. I think it's that simple. I try to be pretty steady, and I'm always working on my communication. I would say is really important. But just trying to be honest, steady, grounded in reality, and always trying to make sure that people feel valued and that they're able to bring them their best self to work and do the work. Um, so I everything I do has always been with and through other people, and so that's what I focus on.
And very last question for you, Adam. What's next for Maribel Health?
Yeah, so we get a lot of inbound questions about how the home-based care can be used to solve capacity issues or total cost of care issues, undervalue. And what we do is a lot of what we call solutions engineering. So we dive in deep with a partner. Every health system is a little bit different about what they need to do. And so some of that solutions engineering with like a Mercy, for example, started with hospital and home, and now it's becoming a question of like, what else can we do, right? That extends sort of the hospital and home model into other programs. And Mercy's been at the forefront of virtual care for a long time. They have a Mercy Virtual, is a huge center that takes care of something like 60,000, at-risk patients in their community. And so what we're working with them is like, how do we take some of these capabilities around hospital at home and extend it into other domains? Bayada is another one, right? And so we're talking with Bayada. We've done some work around palliative care. We've done some work around hospital readmissions. And with them, we're really focusing on some of the core technology needs that they need to ensure that they have super high quality, that they can have the highest possible productivity and job satisfaction, for their employees. And so, and then we got a number of other deep partnerships that we're working on, where we're trying to incorporate both strategic needs of the system, organizing around clinical models, and then deploying technology. So we have a really great engineering shop internally, where we are building out what we call a care orchestration platform, where we sit in between the EMR and different kind of enterprise systems and really think about the care operations and what needs to happen to coordinate and manage care that bridges the home and the hospital. And so we're looking for more partners to work with to build out the technology platform while we're also doing the solutions engineering work.
Adam, look forward to staying in touch with you and continuing to follow along with Maribel Health. Please keep us up to date on any big announcements, anything that really excites you, and look forward to future conversations.
Sounds great, Jared. Thanks for the time.